we're able to help more moms more efficiently and more sustainably because of the use of AI. It's important also not to sacrifice things like safety for the sake of efficiency.
While delivery of healthcare requires significant skilled human power, connecting people to the system, overcoming obstacles to care, providing counseling, raising awareness, all of these things can be scaled through digital intervention. AI is a key piece of that scaling.
AI has been able to help me to work efficiently, where I am able to monitor and tell which schools need my support, which schools need immediate intervention, and respond to their need even before them reaching me.
We're getting more than 5,000 questions a day, and manually reviewing those is no longer possible. So we use AI to flag the urgent questions, make sure that these moms who are experiencing these potential danger signs get the help they need much more efficiently and faster.
The things that could take us too long to screen, AI can screen that in an instant.
The help desk very quickly saw the advantage of this and have also helped us over the years develop the AI models to become more accurate and to become more efficient. And in fact, the help desk often pushes my team, the tech team, to keep on improving the models. It just helps with their workflow and makes their life easier.
Our goal is not simply to have an engaging user experience, but to drive healthy behavior change, to drive healthy uptake of appropriate services and products in the healthcare system. And based on the rates of those outcomes, we determine whether a newly developed tailored interface that leverages artificial intelligence provides added value to the end users, to the population health, and to the health system as a whole.
More than 10,000 plus women have been onboarded. We are now looking at scaling up this project into at least 7 districts in the coming months.
We have 6 languages in the AI assistant right now. We have put it in the hands of about 13,000 extension agents, and we estimate that they're reaching about 200,000 farmers. We rely on A/B tests, and we do those to figure out the effect of new features. We also do user testing and also deploy evaluation studies, particularly around knowledge improvement and adoption of practices.
Yeah.
The 101 users in India reported about 53% of them an improved quality of life because of Farmer Chat. And 73% of respondents said that they had never accessed anything like this before.
Learners are able to interact with the various learning content, and according to their level of competency, the app is able to detect where they are at and support them at the areas of weaknesses by providing activities that will catapult them to the level where they need to be.
For teachers, they benefit since on the one hand we save them time, that they don't have to prepare all of these lesson materials or to individually assess each child to get an understanding of their knowledge state or their levels of performance, while we also provide them with the tools to deliver effective pedagogy.
Where an AI responds and the mom gets the answer to her question immediately, generally moms are more inclined to ask another question or to follow up versus when she might have asked a question and gets an answer a few hours later.
By leveraging data on each mother's question history and clinical background, this allows us to build risk profiles, tailor our messaging, and flag high-risk cases for referral to specialized facilities. So through continuous refinement of our AI models, we are starting to provide increasingly targeted support and also improve maternal health outcomes at scale.
The long term, what does that look like if we're contributing to the open source community rather than making a profit off the software that we're developing? So we really try to focus on what we do and do it really, really well, and partner with and collaborate with other small tech and social change organizations in an attempt to build a community that's sustainable and will be here for the long haul.
We build upon open source tools and share our own tested models to expand affordable AI-driven support for underserved populations. We focus on making our models cost-effective and sustainable so they can be scaled and maintained within the resource-constrained government health systems.
The global learning crisis is far too big for any one organization to tackle. Instead, we are aiming to build the open source tools that any implementer or any government can use to replicate the impact we've already achieved.
We're making our tech stack and architecture of Farmer Chat open source. We are building it as a digital public infrastructure, as a public good that others can use to build their own chatbots, their own apps. And this could be government agencies, it could be private companies or NGOs.
We're all figuring out what our own tech literacy is around data, big data sets, machine learning, document intelligence, and it's really difficult for everyone to stay on top of the newest emerging technologies. It's only together as a community trying to understand these will we generally increase the critical tech literacy of civil society and the human rights community around the world.